Hi, my name is Garrett Staten. I'm a junior at North Forsyth High School, and I'm working through the Honors Mentorship program. Through the Honors Mentorship program, I've been very blessed enough to be able to work through benchmark physical therapy through an internship all school year. Every first and second period of the day, till about 9:30, I go in and I help people out fixing their problems that they have in physical therapy. Like I said, I'm a junior at North Forsyth High School, where I play baseball there at the high school, and that's really part of the reason I've got into physical therapy so much and wanted to do it so much is because I actually broke my hamate bone in my hand swinging, and going through physical therapy and that injury really pushed me. You know, I learned a lot about the body, I learned a lot about even just a hand, and it really just intrigued me enough to want to go into physical therapy more. Benchmark physical therapy, my mentor is Steven and Katie and Matt. I have 3 different ones, and here's Steven with me. And a picture right here, out in front of the building, out in Benchmark. It's a very nice place, and I'm glad I've gotten to experience it. I'm gonna head right into the essential question I have for this capstone project that I've been working on. It is, how does a body utilize exercises and therapy to eventually heal an injury? And through physical therapy, there's been a lot that I've seen, I've worked with through the 9 months that I've been there so far, and as we continue on the presentation, I will detail more about different things that I've seen, that I've never known about, and that you probably haven't heard about either. But yeah, I chose this as my essential question because it's deep and it's a challenging thought if you think about it, with how exercises can really heal an injury, and especially injuries like a knee or even a hand injury like lifting weights and stuff like that. Who knew that that would help an injury get better over time? I'm gonna jump right into my research right here. First I need to know, what do I need to know? The very first thing when I go to my research is, I thought, what do I need to know? Well, obviously I need to know about the body if I'm gonna help it get better. I need to know about the human body. I need to know about different sports and injuries, all different muscle groups, tissue, tendons, ligaments, everything. You have to understand all of that to be able to understand what you need to do to fix all that and make it better. Once again, I went and talked about my broken bone, how it helped me, how it intrigued me in physical therapy again. And then I went on and said what I do know now. Right now, I'm not very knowledgeable about the human body. I don't know all the ligaments, I don't know all the tendons and arms or legs or anything. I do know some muscles, but most of the time it's just a guess, to be honest. And another thing I do know about the physical therapy is all the different treatments they use, and there's a couple that I came in knowing, and then there's a lot that I learned along the way that I never knew that would help as much as it did. But E-stim, if you've ever heard of that, it's electric stimulation. Electrical stimulation, it's electrical stimulation, it's called E-stim, and then there's also different processes like deep muscle massages, dry needling, cupping. I even have a cupping set here at my house, and that I use on my body to personally help me. Even like, so if I played a baseball game and I just wanted to cup up my shoulders or my arm or anywhere if my arm was tight after throwing, I would just slap some cuffs on, suction it up, and hopefully the next day I won't be as sore as I was, and it helps a lot. Okay, the search that I went into, I digged into a lot of different websites, different people, even my mentors that I asked. Here's a few questions that I asked my mentor. while working one day, and I asked them, what's the most difficult part of your job every day? And they said, balancing a schedule and giving time and effort to each person that they deserve, which that is a big part in being a physical therapist because you have multiple patients at a time. Every hour you'll probably see about 4 patients, and that's pretty hard to keep up with, giving each one the time they need to talk about their injury, to discuss it, how they've been, and to help them with at-home exercises that they need to be doing. Another question I asked is, what's the hardest injury to apply therapy to? And they said spinal stenosis and lumbar treatment, which is mostly back, especially lower back trouble. That's very hard to deal with as it's a very sensitive part on every person's body. And then the last one, for you, which injury do you understand the most and how? And they said low back pain as well, because that's how many patients they receive every single day, just with lower back pain, and they come in and that's the one they see almost every single day. And throughout my interview, I asked her many different questions about what the body needs for. I learned that there's many different types of treatments as well that comes in to healing the body and what it can do to help relax a person, calm those muscles, or even wake them up and get the blood flowing and get them working and getting them stronger. And that's really where the types of treatment that I learned came into play. There's, I knew from my prior knowledge, I knew E-stim and cupping, but I never knew about dry needling or scraping or any of the other ones like tape. Who knew tape? Just putting tape on your hand could stretch out a muscle and help it stay in its place and heal it. Now we're going to move on to exercises, where this one's really, it's kind of difficult to understand if you really think about it. So if you have an injury, you really don't want to exercise that muscle because it's in pain, obviously. But what you need is you need to exercise that pain out. It all starts with a process, and it all starts with getting the range of motion back in it. If you had an elbow injury, you couldn't move your elbow for 6 months. You have to start with getting the range of motion back in by doing exercises to be able to range of motion back. We get knee patients every day where they only do 3 things because they just got off the surgery, whether it's riding a bike and then stretching it in with a strap, and then they get worked on by the therapist. And then after you get a good range of mobility where you're able to drive with the knee, or you're able to run or walk even, that's when you're able to start getting strength back in the muscle. And that's when you're able to start strengthening that muscle and just totally obviously the exercises won't be heavy, just squatting or anything like that right away. We normally start small with different things like a shuttle, where it's subtle movement with the knee, just using lightweight and strengthening back up. And we'll move up eventually, and over time, whether it's a month, 2 weeks even, 4 weeks, however long it takes. Every person's different too, because you never know what you're gonna get from a person. They could work harder every single day, go home, work even harder to get everything better, stretching and working and drinking water and everything just to try and heal that. We can get a lazy patient who doesn't want to do all that stuff, so they'll be in a lot longer and have a tougher time over time with their injury. What I discovered finally, wrapping up all the information that I learned throughout my mentorship, is I've discovered the journey of answering the essential question, in that as I mentioned earlier, I don't know everything. I haven't graduated PT school. I've never even been to PT school. I took a 7th grade anatomy class where I learned a lot of the muscles in the body, and that's really all I know. about the body, but I do know the many differences that it takes if you want to heal an injury, the exercises that it takes, the work ethic that it takes, and I know it's painful, but people go through it every day, and it's tough. Another thing I learned throughout the process is the many treatments for many different injuries. Like I mentioned, the soft tissue, joint mobilization, and muscle pains. There's many different things you can do throughout an injury to heal it, whether it is scraping or dry needling. We've become so technologically advanced that these cups where they pull up your skin and blood flow through better. Like, who would have ever thought of that? And it's very effectively used every day in a physical therapy office. And finally, I discovered that exercise plays a major role within healing an injury, whether it is just riding a bike really every day with a knee injury, just riding a bike, getting that range of motion back, then eventually getting on a shuttle and using weight to distribute muscle back into your leg injury that you've had. It is really efficient in the way that it works, and it's really cool the way that it works as well. Finally, I have my blog here, which I've been working on all school year through the mentorship program. We have many different things. With the interview, it's even on the blog. If you have any questions about that, I'd be willing to answer it. And yeah, that's pretty much all I got for y'all. Thank you.